Thank you, Dr. Jaimo. The chair will now call to the lower podium Kevin Klauer, DO, EJD, and CEO of the AOA for his report. Dr. Klauer.
Thank you, Mr. Speaker. Thank you, Mr. Vice Speaker. President Jaimo, outstanding address. President-elect Gelb, all of our delegates, the entire House, friends and colleagues, family who are with us today, our outstanding state affiliate and specialty college executive directors and CEOs, the future of our profession, students, residents, and fellows, and of course, our amazing, I know I'm biased, our amazing and outstanding AOA staff. Welcome to the 102nd Annual AOA House of Delegates meeting. Now, if you'd like to hear the rest of this roughly 10 to 15 minute address, please go to your app on Election Buddy. Kidding, of course. Just trying to lighten the mood. Are you glad we've moved away from Election Buddy? I think you are. But we certainly are ready to go there at any point in the future where something disrupts operations of our House. And we'll make sure that we can conduct our business as you would expect that we would. Are you aware that during the pandemic, we are not aware of any other organization, even larger organizations, that were able to conduct full debate and full voting capabilities of their House of Delegates? The American Osteopathic Association didn't let a pandemic get in the way of its important business in serving our community, serving our profession, and for all of you to serve your patients. And as staff, we are very, very honored to try and be nimble and try and be innovative in service of our Speaker and our Vice Speaker and all of you to make sure that we could conduct that business with you and for you. We are the operational aspect of the House of Delegates. You shouldn't have to worry about the platform. You shouldn't have to worry about the technology. Oh, trust me, we do. So you won't have to. Now, what I'd like to focus my thoughts on today a little bit is really one word. It's faith. Faith is something incredibly powerful. There is perhaps nothing more powerful than faith. The faith that we have in our profession is beyond challenge, it is beyond reproach. And we need to have faith in our profession, in each other. And we also would like for you to have faith in your American Osteopathic Association. The AOA is a strong and vibrant organization. Follow the OMP reports, follow the annual reports, and you'll see what we're trying to do. 2 annual reports ago, you'll notice that we reduced operating expense by 17%, and the following year, another 23%. Has anyone noticed a reduction in service or less programs coming from the AOA in service of all of you and in service of our members and our profession? I challenge you if you have, because I know the truth to be this. We have reinfused those dollars to be more meaningful to the association. So the association doesn't create programs to serve itself, but to serve those who rely on it. We can do more with less if we're wise with the dollars that we have. And we covet the dues dollars that people give us and make sure that we invest them wisely in the association. We've moved away from reducing expense at this point. We're as nimble and as efficient as we possibly can be. Where we have expense pickups, we'll log those in when we can. We'll identify them when we can. Now we're moving toward optimizing and creating new revenue streams so we can also, again, further support the mission and the vision of this wonderful, wonderful association. This year, and was reported just a couple days ago to the Board of Trustees, we've now created an additional roughly $2.5 million annually of new revenue that never existed, either from new programs or optimization of existing revenue streams in this association. If the world changes, we will be 2 steps ahead of it. And we will make sure that this association is here to serve the needs of this profession as long as you'll have us. And we will make sure that we are relevant to you while we're creating relevance to the rest of the healthcare community. So have faith in us that we're a strong organization. And your AOA is working tirelessly to make sure that we provide the service you want. Our former persona of a somewhat regulatory agency regulating no one has been shed. This association is all about, and all of our staff members are all about, this Board of Trustees is all about selfless service to you, the people that you report to in your constituencies, and the patients that everyone serves. You may not know this, but our staff has been empowered that anything that we do, any resource that is spent, any minute in the day that is spent doing something that does not meet our mission or vision, they are to push back and challenge it. If we're not serving you the way that we should, we need to rethink what we're doing with our time and our resources. And your staff has risen to that occasion and have helped to create many of those changes that we, of course, work collaboratively with the Board of Trustees to decide if they're the right strategic choices for us. So very proud of what we're doing to be a strong association for you. Have faith that we will advocate for you when there are payer issues. The AOA, in conjunction with AOIA and the wonderful staff and others, will absolutely make sure that reimbursement, appropriate reimbursement, is maintained, not just for physician-level care in general, but for critical services like OMT, OMM. You know, other organizations and associations and other physicians are frustrated by reduced reimbursement, let's say by modifier 25. What they don't understand about us, and the payers are learning very quickly, is that when you challenge reimbursement for OMT or OMM with modifier 25 or any other obstacle to fair reimbursement, you challenge one of the foundational principles of the distinctive practice of osteopathic medicine. To us, it's not just about the money. Matter of fact, it's less about the money than it is about protecting this profession. We'll advocate for you for payer issues. And I think you already know that we do great work. Our wonderful DC staff does amazing work with legislative and regulatory advocacy at the federal level and at the state level to assist our wonderful state affiliates. They do great work. We will advocate for you as well as the general physician community whenever we're called upon and wherever we see it's appropriate and it's fit for us to do so. And I think we've been very effective. I'll submit to you that despite the fact we're a smaller association than many larger organizations in healthcare that have a voice on Capitol Hill, our voice rivals theirs and equals theirs. People are listening to us because we are no longer focused on just building programs within the osteopathic profession. We are assimilating into the general healthcare community, but without losing our osteopathic distinctiveness. We have become, in my estimation, and dismiss this if this does not resonate with you, more relevant to the world, to the United States, and to the general healthcare community than we ever have been, because they're exposed to what we can do for them. And we've been very collaborative so that we do not compete with others who are in that space. Our MD colleagues welcome our collaboration work with us. That's a carefully navigated strategy. We value their partnership and collaboration. We have something different to offer. They know it, they value it, we know it, we value it, but it's not a competitive posture with anyone. We are not less than, but we're not trying to be somebody else. And we want to make sure, as we're recognized, we don't forget and we don't lose the osteopathic distinctiveness that we all decided to participate in when we selected our College of Osteopathic Medicine. Now, something near and dear to my heart and the AOA is what we believe to be a primary charge to advocate for you for professional advocacy. When on occasion, all too often sometimes, when our credentials are challenged or minimized, when our profession is attacked, and it does still happen, many people help. And I think many stakeholder organizations in the osteopathic profession have been very effective in doing so. But this association takes this very seriously, and we believe we have a primary role to make sure that we step up. We have a public relations system that works very well to make sure that we're attacked. We do not do what this association used to do, try and educate someone who wasn't interested in being educated about us anyway with a white paper or a phone call behind the scenes. I've said it before, and it's probably worth repeating today. If you attack anyone in this room, or anyone that you serve, or any one of our members, or even a future member, let me word it that way, if they're not a member of the AOA will come to your assistance, and you need to pack a lunch. Our goal is not to squelch a negative narrative. Those are opportunities. We want to seize a negative narrative, prolong it, replace it with the appropriate, accurate, and positive narrative, and right the ship. And we've had many good examples of how we've been able to do that with our communications and marketing and public relations processes and the resources that we have. We don't shy away from defense of our profession. Let's be relevant to each other and relevant to the healthcare community. Someone says we're not distinctive, well, we beg to differ, and we'll tell our story. One good example recently, and I don't want to share a bunch of them, but I'm proud that the association is mobilized effectively for all of us, and many of these was really the whole Tonight Show issue. Were you familiar with that last September? Yeah. Hassan Minhaj and Jimmy Fallon decided to have a little exchange about MDs and DOs. First of all, they said that there's a battle. There's no war. They didn't ask MDs or DOs or MDs. We're collaborative, we work together. And I won't go through all of it because the more I talk about it, the more frustrated I get with what happened. And they basically rated us as RC Cola, but MDs as Coca-Cola. That was enough right there. And I want to share something with you also. Yes, our communications and marketing and public relations team and the processes we've built, hardwired policies, when this happens, we flip the switch, we take care of our people, is important. But do you know our roughly 135 staff are just as invested into this mission and vision as everyone in this room? Just because they don't have a DO behind their name, trust me, they love this profession. That's why they work so very hard for all of you. Nicole Blankenship contacted me at about midnight after seeing that episode of The Tonight Show. My first response to her is, don't watch bad TV. But I had finished a bunch of emails, I was going to go to bed, and I said, why put off to tomorrow what you can do today? And if Nicole was concerned, one of our staff members, just as invested as I am into the mission and vision, has a concern, I'm going to look at this clip. That resulted in several carefully worded and immediate social media responses to go out and invoking our public relations process the very next day, which includes our Board of Trustees and other social media personalities that are in the osteopathic community. And we mobilized our event. What I love about it is it didn't stay our event. The AOA mobilized its resources and used its voice and efforts to raise an important issue that would have gone unnoticed otherwise. And there was a massive response from many, and everyone did a great job, to the end point of there was a 10-minute YouTube video created, which we accepted as an apology. Some think it didn't go far enough, but when a personality like that is willing to professionally create a 10-minute video and somewhat say, are we good after doing it, we'll take the form of apology that they offer. And I will submit to you, through that negative narrative and through the efforts that all of us took together, starting from the AOA and expanding from there, we got more benefit with exposure and understanding of the osteopathic profession than we have had from former marketing campaigns for the osteopathic profession in recent years. And you know what we paid for that? Love, commitment, and faith that we can do this right. Not one penny. Not that marketing isn't important. We still do that as well. But I absolutely wanted to emphasize that to you. We'll be here for you. We absolutely will. When physician rights are at risk, they're not just osteopathic physician rights. So when there is a scope of practice issue, I won't name any specifically here, even when other physician organizations have been silent or haven't gone far enough, the American Osteopathic Association has stepped up to speak about physician rights on scope of practice when others were silent. We have again become more relevant because people appreciated our perspective and needed to have an organized physician voice to say, we truly value the contributions of our advanced practice registered nurse and physician assistant colleagues, and I mean colleagues. But we also believe that a physician-led, team-based model of care is most appropriate. We really do. And therefore, we need to make sure that we emphasize how important physician education and training is. And there is no other healthcare practitioner or clinician that gets that level of training or education. We cannot be discounted. That is not merely an osteopathic issue. It goes way beyond. We have been here to be more relevant and to advocate for all of you. DO Day was amazing, the new format. 1,100 people between the virtual and in-person experiences. We're so excited that it's growing the way we want it to, from the wonderful, largely student experience that it used to be, building on that, not displacing the students. We want them all. We want more students, but making it truly an osteopathic community advocacy experience and event. And we're making the progress that we had hoped to make on that. And President Jaimo mentioned, and it's worth emphasizing here, a bipartisan resolution in the Senate unanimously passed to recognize National Osteopathic Medicine Week, April 26th, while we were at DO Day. Again, we're relevant. And for those of you who are waiting for new news, DO Day next year will be held in conjunction with National Osteopathic Medicine Week. Now, what else should you have faith in? Is advancing the osteopathic profession and the distinctive practice of osteopathic medicine. Let's do this together and trust that we will help and we'll do our part. So the branding campaign, really exciting. Modern medicine for your body, mind, and spirit. It's a tagline that can get us started in a meaningful conversation with patients and others. Do you know that just through the Olympics, cable TV alone yielded 19 million impressions? We are moving past awareness to awareness and understanding of who we are and the value that we bring. Digital campaigns to date on this new marketing campaign have yielded 50 million impressions. People are clicking, reading, and learning and saying, you know what? I think this is the alternative I've been waiting for. And now I understand. I haven't just heard that DOs exist. Now I know what they can mean to me at the bedside. Very excited about our team's effort on that specifically. Osteopathic recognition, creating the recognition program. Over 3,000 graduates from OR programs have received recognition from the AOA, and we will do more. The osteopathically distinct CME task force has met, created by the Board of Trustees in collaboration with the staff, and we work together with many stakeholders to say, how can we make CME that is sponsored and accredited by the AOA truly osteopathic? Not just because it has the AOA's logo on it. That doesn't carry the water in debates in the House of Medicine. It's distinctive. We're distinctive. We're infusing that distinctiveness into CME going forward. The Osteopathic Research Consortium was something that was in the works for about 18 months. I know other efforts had occurred in the past, and some were successful, some were less successful. But you know what the AOA wanted to do with this is create an environment to bring the best researchers, the most experienced researchers in the osteopathic profession together in a non-confrontational, non-competitive environment to spend some of their time and energy together to create a national research agenda so that we can prove the value of the care that is provided by this profession. Oh, thank you. What was also important was selfless service. The AOA is supporting this through our staff support. But something that the AOA needed to do when it creates programs is get out of its own way and let others lead programs. We have separately incorporated this, so this is not an AOA endeavor. We are supporting it with our time, our resources, and our staff, but the advisory board that will decide the national agenda, they're all deans and researchers from the most developed research programs of our comms. We wanted to create a platform and an environment for the right things to happen. We didn't need to seize control of the agenda itself. That's the type of selfless service we believe this association can provide and the difference that it may make. And something else I'll share with you, and I could stop here, but I've got a couple of things I'd like to say if you'll tolerate a few more minutes from me. Has anyone ever heard of the Patient Safety Act of 2005? Thank you. Thank you, Dr. Capro. I needed one person. He's always that guy. So thank you. And thank you for not presenting to a microphone. Yes, thank you. Oh, we're friends. We're all friends here. Wow, was that the best thing I've said so far? Wow. Okay, all right, maybe I should stop here. Well, the Patient Safety Act of 2005 was to really make sure that the nation created emphasis on patient safety, improved quality of care, that was also in a non-judgmental setting. People could share data to make sure that the whole needle in the nation could be improved to protect patients. Care isn't always perfect, but there have always been barriers. And I will fast forward that once Congress passed that act, the rule was to be enacted by the Secretary of Health and Human Services. Health and Human Services said, you know what, there's a component of this called the Patient Safety Organization piece, which is really a huge part of the act. We want the Agency for Healthcare Research and Quality to implement this component of it. I'm here to tell you today with great enthusiasm that 3 months ago, the American Osteopathic Association, PSO, was listed by Health and Human Services and AHRQ as, I believe, the first, but currently the only, osteopathic patient safety organization in the nation. We did that together. We will prove that the distinctive practice of osteopathic medicine that all of you provide and the people who work with you makes a difference. And patient safety is one way to prove that as well. We will serve our community in that regard. Certifying board services, I will just let you know we are so focused on making sure that we are always improving. We're innovating. We're making it more cost-effective. I stood before you, I've mentioned a few things virtually, but before you 3 years ago and said we would move at exponential pace to build on the 80 years of excellence that we've had. I hope that our staff and I have made good on those promises. We're not perfect, but we're better than we ever have been, and our goal, our sole goal, is to preserve osteopathically distinct competency assessment for board certification for any DO who wants it in any specialty or subspecialty that they possibly would like to be certified in. That is our goal. And I will conclude with 10 points. They're quick. They're quick. That wasn't meant to be that funny, but I'll do it again. I'm going to conclude with 10 points. We did this last time, and I'm going to do it again because I mean it, and I've done this almost everywhere I have been since we spoke last time about this. Please grab a pen. Please grab a pencil. This is my cell phone. If the American Osteopathic Association has not served you in the way that you see fit, if you need to give me guidance, if you think I need guidance, if you think we need new information, and you can't get your answers elsewhere, or you just want to go directly to me, this is the number you want to call, 312-502-2500. Now, I said that fast because I think it's been really fun to do that at smaller meetings, and people say, wait, I didn't get that. So I'll do it again. And I'm certainly not trying to say it quickly so you don't get the last number right. So, all right, 312-502-2500. I want to thank you for your service, thank you for your commitment, and I want to thank you for the opportunity to allow me to do whatever I can to serve you as selflessly as I possibly can. And I hope that we will all, for centuries to come, remain DO proud. Thanks, everyone.